respiration system for the hip joint or the femoral acetabular joint. When we are walking, we are repetitively lifting our leg. That is going to be an anterior superior roll and an inferior posterior glide of the femur on the acetabulum. We have a convex femur moving on a concave acetabulum. So we are going to look at restoring the inferior posterior glide of the femur. We're going to release the iliacus muscle, the glute min and medius, so that the femur can glide inferiorly. We're going to stretch those muscles, and then we're going to strengthen the muscles that encourage the posterior and inferior glide. And there are more muscles that we can release and stretch to encourage the inferior glide, but I'm going to start with these basics. Sometimes patients have so much stiffness that you want to start in other areas in order to even get to these. But this is going to address the mechanics to help with the inferior posterior glide of the hip joint. I will release the iliacus muscle, so that's the muscle right inside the ilium. I'm going to release the glute min and medius on the outside. I'm going to stretch those muscles and then strengthen the ones to encourage the posterior inferior glide. To release the iliacus, I will use a single lacrosse ball, and I'm going to place it, find my ASIS, and go right inside that ilium, place the lacrosse ball, and lie onto my stomach, placing pressure onto that area. When I find that area, I'm going to hold and spend about 2 minutes to release the fascial tension. I'm also going to release muscle tension. I can pump my leg up and down to work on releasing the tension in that area. After I spend 2 minutes working on the fascia and muscle there, I'm going to go to my glute min and medius. The minimus is just above the trochanter, and then coming up right under the iliac crest, I'm going to have my gluteus medius. I'll place the lacrosse ball there. This can be really intense to begin with, but what I'm going to do is find my area, place the lacrosse ball, and then keep my back leg on the floor. I'm going to lie on my side. I'm going to rotate my body onto that area. And if it's too intense, I'll push up to hold some of my body weight. If I can apply my body weight onto that area, I'm going to sink and relax down into those muscle groups. Then I will slowly bring my hips an inch forward, anterior, and then an inch posterior. And that is just going to allow me to go along the fibers perpendicularly and addressing the tension in those areas. Again, 2 minutes for fascial release. So spending as close to that amount of time that I can. Sometimes it is too tender to even do that to start with, so 20 seconds may be all the pressure of tolerance to start. Then I want to stretch those muscle groups, and to do that, I'm going to go into a hip flexor stretch, but then I'm going to rotate my hips so that I can work in getting to the inner portion of my thigh and getting up into that iliacus muscle. And I'm going to do a moving stretch. So I'm going to slowly move throughout the stretch. So then rotating my hips then to work on getting into the outer portion, that minimus medius. And then I will rock and slowly go back into the iliacus. I will spend 1 minute doing a slow moving stretch. Relax out of that, do another minute of this slow moving stretch, and then a third to get the most out of the stretch. So this is just a slow moving stretch between the inner part of that pelvis into the outer part of the pelvis. So that is the release and then the stretch. Now I want to strengthen. I am going to isometrically strengthen my abductor so that I can get an inferior glide. In a closed chain, the acetabulum is going to glide and roll superior with our convex concave roll. The concave on convex is going to roll and glide in the same direction. So we're going to get that inferior glide. And then I'm also going to isometrically engage the adductors so I can get that inferior contraction to encourage that glide, but it's going to be the muscle contracting in the direction that we want to encourage the glide. So I'm going to take the soccer ball, I'm going to squeeze in to get an isometric adductor contraction, then I'm going to do a hip drop. I'm going to go down, and then pushing on the outer leg, I'm going to lift my hips so I get that concave movement on the convex femur, the concave acetabulum on the convex femur, so that I've got my superior rolling glide and then the inferior glide of the femur. And I'm contracting the muscles that are going to encourage the femur to glide inferior and back down. Lifting, hold for 10 counts, and come back down. And I will do two or three sets of a 10-second hold, and then go into working on engaging the rotators to strengthen in the direction of the posterior glide. So I'm going to go into a clamshell position, have a slight flexion in my hip because I want to engage the muscles while I'm in that flexion, and then go in the direction of the posterior glide. So I'll do 3 sets of 12 clamshells and strengthen that direction. Then I will do 3 sets of 12 hip extension, keeping my knee bent. So I'm going to engage the glute max while I'm in that flex position. When I'm in quadruped, I'm getting a posterior glide pressure onto my femur, and then I'm also going to engage the glute max to encourage and go in the direction of the glide. So this is going to be the strengthening portion of restoring the inferior posterior glide of the hip if we are having trouble or pain associated with the inner groin or in a repetitive hip flexed movement pattern. And that completes the arthrokinematic restoration system for the hip joint.